Come on in. Hi, I'm Sam.
Hi, I'm Alice.
Nice to meet you, Alice. So what brings you in today?
I don't know, I just guess that I've been feeling like really down, really sad and stuff like recently. Yeah.
Okay. Just before I kind of dive into any of it, I just want to, just quickly say that if at any point today you do feel uncomfortable, please let me know and we can stop it there. And if at any point, or if you say through this meeting, if there's at any point I feel that you're in danger or risk to yourself or to someone else, we'll need to, I'll have to talk to someone else, like a parent. You said you were feeling a bit down recently. Would you like to kind of expand on, why that might be?
Well, I mean I don't know, I'm just having a pretty hard time at like home and at school and stuff, and I had a pretty big argument with my mum last night. And yeah, I don't know, I've just been feeling super like upset more than I ever have before.
Okay.
Mm-hmm.
So you were saying, you've been feeling quite upset, not just with, with not just your school life, but also at home with your family. How does that make you feel that that you don't get along with a lot, most of your family?
Honestly, it doesn't make me feel too good. Like, I really need my mum most times, but because of my brother's autism, she really doesn't have much time for me anymore. And yeah, I just feel super neglected and just like left out all the time when all I need is just to speak to my mum.
What have you been doing that's maybe been trying to make you kind of feel better?
Well, sometimes I get to speak to my auntie, and she's my mum's sister, and she's so cool. And she whenever I talk to her, I automatically feel better just because she listens to me, and she just actually takes time out to make sure she knows what's going on in my life and stuff. But I don't really talk to her as much as I wish I could. So yeah.
So other than your auntie, is there anything else that makes you feel a bit better, makes you feel a bit happy?
I've been drinking a bit recently, and I hang out with these guys after school who kind of also make me feel better. But I guess it's only because I hang out with them to really just drink and yeah, just stuff like that.
Okay.
It kind of helps me forget about my problems for a little bit, so yeah.
Okay, there's something I have to ask you. Do you at all self-harm?
Yeah, I definitely have been more than I used to. Yeah, it's pretty much all the time now.
Okay. How long has it been going for, would you say?
I'd say definitely over a couple of months. I wouldn't know exactly how long.
And how do you self-harm?
No, it's always kind of scared me, so I found out this method of burning yourself. So yeah, I just burn myself where no one else can see me. Yeah.
Okay. Whereabouts do you burn yourself?
Mainly on my thigh, and yeah, just places where my clothes will just cover it, I guess. Yeah.
Okay. Thank you for telling me that. I do want to ask another question that's, it is quite confronting. Have you ever had the thought of killing yourself before?
Yeah. I mean, I definitely have, and I've definitely been thinking about it a lot more than I used to as well, so.
Okay. Have you gone as far as the thinking of how you might do it?
Yeah, well, I've been saving up some of my brother's medication for a long time now, so I've now got quite enough, and I know that if I took all of them then I would die. So yeah, I guess I do really have a plan.
Okay. When do you think, have you kind of created a date on when you might go through with it?
Well, my family's going away in like 2 weeks, and they're going away on the weekend, and I'm gonna be at home alone. So I think I'm just gonna do it then when they're not really around to kind of stop me and stuff like that.
Okay. Have you thought about killing yourself today?
When I woke up this morning.
Okay. Thank you so much for telling me that. It's a hard thing to, have to be able to tell someone else, and, really thank you for bringing it up. Do you have any other questions for me at all, or do you have anything else that you want to add to what we've spoken about today?
No, I think I'm okay.
Okay. From what you've told me today, I think it would be very worthwhile to have one of my colleagues who's a mental health nurse get in contact with you. From what we've spoken about, I am quite worried about you, and I feel that you are at the moment a risk to yourself. I'm going to need to tell your parents about.
Oh, really?
From what we discussed earlier on, it is something I'm going to have to do, but you'll speak to the mental health nurse. We'll really try and tackle this, okay? I'll go just talk to her onto the phone now, but before I do so, would you like me to get you anything to drink, or?
I'm okay, thank you.
Okay, well thank you for talking to me, and I'll be back shortly.
Thank you.
Hi, it's Sam Sanjanita here. Is that Harriet, the MHN? Great. I'm just calling from Albanese Senior High, and I'm just calling about a particular student that I've just spoken to. Her name's Alice May. She's a 17-year-old, and she came in at about 10 a.m. this morning. She presented to me pretty upset and quite emotional too. Quite concerned about her as well. She was cooperative and quite talkative. She does experience a hostile relationship with her family and her friends. Now, she has expressed that she does self-harm, and she also has a suicidal ideation. And when I asked her to expand more on it, she did say that she had a plan in place for it. So I am quite concerned about her. I would just like to order an MSc for her and a risk assessment. Great, I'll send her to you this afternoon. Thank you.
Hi Alice, my name's Harriet. I'm a mental health nurse here at the Albany Rural Hospital. I'd like to chat to you a bit about why you are here today. But before we begin, I just want to let you know that everything that you say here is confidential. But if there is any cause for concern, I will have to inform your parents and seek more medical advice, if that's okay. No worries. So I spoke to your school nurse earlier on today, and he expressed a few concerns with me about you. Would you mind telling me what you think those concerns were?
I guess I did tell him that I've been feeling really upset recently, and I also brought up the fact that I've been self-harming more than I used to be. So I guess that's probably why he's told you.
Okay. Yes, so that is correct. Yes, he did inform me that you have been self-harming, and that was a big red flag for us. So that's why you're here with me today. But I would like to ask you a few more questions, if that's okay with you. Why was today such a tough day for you? Why did you feel the need to go in and speak to the school nurse today?
I don't know, I had an argument with my mum last night, and then I woke up feeling really down this morning.
Okay.
And I don't know, I just thought that what's the harm in going to speak to someone about it, I guess.
Yeah.
But yeah, today I just felt really down.
Okay. So you said you had an argument with your mum. Do you want to maybe share with me what that argument was about?
Well, so I went to her to try and tell her that I was feeling upset because I wasn't feeling too good last night, and then she just kind of like ignored me to begin with, which really frustrated me because she does this every time I try and like talk to her about how I'm feeling. She just says she's got other like more important stuff to deal with. And I don't know, I just feel like I'm just never being heard, and I just really wish she'd pay more attention to me because I really need her.
Yeah. And so at home, who do you live with?
So I live with my mum, my dad, and my brother.
Okay.
My brother has autism, which is like really, really difficult. Yeah, so I don't know.
Okay, do you want to maybe tell me a bit more about your brother, and what do you mean when you say it's really difficult?
Well, I mean, like, obviously I don't blame him for having a disability, but like, because he like needs so much attention and care and stuff all the time, I just feel like my parents kind of forget about me, and I just feel like lonely and neglected like all the time. So yeah.
I'm sorry to hear that. Have you ever experienced any sexual, physical, or emotional abuse from your family?
Never, no.
No. Do you ever speak to anyone else about how you're feeling neglected and how you're feeling lonely?
I sometimes call my auntie, who's my mum's sister, and like she's the only one that I can really talk to about any of it because she knows like how my mum can be, and she's also just there to listen, like just to listen to me because she knows that I don't really have anyone else to talk to. So.
Do you engage in any activities here in your hometown that make you feel better?
I like to drink and sometimes smoke a bit of weed, but that's probably it.
Okay, and how often do you drink alcohol?
I'd say every like second day.
Okay.
Yeah.
And you said that you smoked weed. Do you use any other drugs like cocaine, methamphetamines, ecstasy?
The guys that I hang out with, because they're a bit older than me, they like to do that stuff, and I've seen it, but I've never done it.
Okay, so they're doing it around you, though you've been exposed to it.
Yeah.
Okay. How does it make you feel engaging in those kind of activities?
It makes me feel pretty good because like, first off, like it makes me feel like I'm a part of a group, like because we're all doing the same stuff, and they kind of include me, which is like something that I'm not really used to anymore. So that makes me feel really good, and it like just smoking and even drinking just makes me feel relaxed and less anxious.
Yeah.
So that's always good.
Okay, a bit of temporary relief, would you say?
Yeah, for sure.
And kind of coming back to what we first kind of spoke about with self-harm, how do you self-harm?
I don't know, like I saw this show once and this girl started burning herself, so yeah, I just kind of burn myself on my thighs, just places where other people can't really see.
Okay, and how often do you do that?
Pretty much every day.
Okay. And did you have your self-harm today at all?
Yeah, I did before I came to school, so this morning.
And how would you say that self-harming and burning yourself makes you feel?
It makes me feel good at the time because like it makes me feel like I'm in control, and it's something that like, yeah, just something that I have control over, which is something I'm not really used to.
Okay.
Yeah.
And why do you like feeling in control?
I guess because I always feel like just shut down like by my family, and always feel like they're just telling me what to do and how to do things, whereas when I'm the one self-harming, like it's really up to me how much it hurts, and just like, yeah, just how much pain I'm really inflicting on myself. Yeah.
Okay. And apart from self-harm, have you ever had suicidal thoughts?
Mm-hmm.
Okay, and how often do these thoughts come?
I used to not really think about it too much, but recently it's been like almost every day, but like every second day maybe.
Okay, and have you put a plan together on how you would go through with it?
Mm-hmm.
Okay, do you want to tell me about that plan?
I mean like, so I've been collecting these pills for quite a while now, and like I know that I definitely have enough to actually do it, but I'm just waiting for the right time. So like my family's going away in like 2 weeks on a holiday,
Okay.
and I'm going to be at the house alone, so I'm thinking that's when I'm going to do it.
And where have you gotten these pills from?
I think they're my mum's like pain medication or something. I'm not really sure, but I've like looked up what it is, and I know that if you take too much you can kill yourself. So
Okay, and you said that your family's going away in 2 weeks' time, but you've had the medication for quite a while, the right amount. But why would you say you haven't done anything before?
I guess I was a bit scared, and I was also just kind of waiting to see if things would get better, to see if that maybe that my friends would be nicer to me, or like my mum would start being nice to me. But honestly, I just can't see an end to it now. I don't see it getting any better.
Okay.
Yeah.
And have you had any previous attempts?
Not yet.
No. And has anyone in your family ever committed suicide, or any friends around you?
Not that I know of. I don't think so.
Okay. Now I'm just going to gather some other information. With all these negative thoughts, would you say that it is more of a feeling or intrusive thoughts, or is it more of a voice inside your head telling you all these negative things?
I'd say it's definitely a feeling all the time, and I do get intrusive thoughts just telling me that I really should just end it all, because it'd be better off for everyone else if I was just not here. But never really voices, or I don't really see things that make me think that. Yeah.
So Alice, have you got any other questions for me today?
No, I just kind of want to go home.
Okay, you don't want to speak about anything else?
No.
Okay. I just want to say thank you so much for speaking to me today. It really takes a lot to speak up about things that are bothering us, so you should be really proud of yourself. Because of what we spoke about, and obviously there were some concerning things regarding suicidal thoughts and things like that, I will have to pass this information on to your parents.
Do you have to tell my mum and dad?
Yeah, I'm sorry. Because obviously there is that cause for concern, we spoke about that before, I really need to let them know. And what else I would like to do is refer you to one of my colleagues for a further psychiatric assessment, and depending on what the information he gathers from that assessment, we might need to keep you overnight. Okay? No worries. Well, yeah, thanks so much again. But in the meantime, do you want me to grab you a drink or anything?
I'm okay.
Okay, will you, if you need anything, just let one of the nurses know and we'll come and find you, okay? So just stay here for the time. It'll be about half an hour, okay? No worries. Thank you so much.